Hi, I'm Geraldine Martinez. I'm going to be filming my head to toe assessment today. I'm going to start with washing my hands. Brittany, my name is Geraldine. I'll be doing my head to toe assessment on Brittany today. If at any time you're uncomfortable, please let me know. I'll be asking you questions as we go through the whole assessment. If you have any concerns about whatever particular area we're assessing, please let me know. And just let me know if there's any past medical history so I can incorporate that into our assessment. I am going to start with, how old are you?
21.
Do you know today's date?
March 21st, 2016.
Perfect. Do you know where you are?
Parker, Colorado.
And who is our current president?
Obama.
Okay. Can you tell me how tall you are?
5'2".
Okay. Can you tell me how much you weigh?
150 pounds.
Okay. And I'm going to measure your waist really quick. So just lift your shirt a little bit. I'm going to go without exposing too much. I'm going to go just around her belly button. Okay. I don't want to show too much, but I am measuring all the way around her waist over to the middle of her belly button. Perfect. Okay. Have you gained or lost weight recently?
No.
Okay. So based on your weight and based on your height, your BMI is 27.2. Just so you know, a healthy range for your height would be anywhere from 19 to 24. Brittany, I'm going to be doing your blood pressure now. I just need you to hold your wrist level with your heart. While we're doing that, I am going to be counting your respirations at the same time. That there. Okay. So I had your respirations at 22. Blood pressure is 124/93. Okay, Brittany, I'm going to put this under your tongue and take your temperature. And the last thing I'm going to do is I'm going to also just take your pulse. Okay. I'm going to do it for 30 seconds here. Okay. So your temperature was 98.1 and your heart rate was 74. Okay, Brittany, now I'm going to be inspecting your head and face. I will start with inspecting your skull. I'm going to be checking for symmetry, any lumps or bumps, checking the texture of your hair. If you could just kind of lower your head a little bit so I can look at it. And I'm just going to feel through it and see if I feel anything unusual. At the same time, I'm feeling your hair. Okay, put your head back. Okay, if you could just take your glasses off for 1 second. I'm going to palpate your temporal arteries here. Do you feel any pain or any pressure?
No.
Okay, and then I'm going to also check some of your sinuses. Tell me if you feel any pain or pressure with this.
No.
No? Okay. Anything here?
No.
Okay. And now I need you to open and close your jaw. Do you feel any pain with that?
No.
Okay. So the next thing I'm going to do is I'm going to check, see if you have sensation on different parts of your head. Let me know if you feel this. I'll just gently poke with the paper clip. Can you feel that?
Yes. 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 Yes.
Okay.
Yes.
Feel that? Okay, Brittany, the next thing I'm going to do is test your facial nerves. So I'm going to ask you to do a few simple things. I need you to smile. I need you to frown. I need you to blow out your cheeks. I need you to raise your eyebrows. And I need you to close your eyes tightly. Very good. Okay, we are going to start the eye exam portion of the assessment. I am going to start with first examining your eyes. I'm going to gently pull down and look inside, look all around. Can you look down? Look up? Okay, I'm going to do the same thing here. Look down, look up. Okay, now I need you to follow my light with your eyes. I'm going to do it for both eyes. Here, here. Okay, now follow it over here. Just your eyes. Here, perfect. Okay, so now the next thing we're going to do is we're going to do your corneal light reflex. Now I'm going to be checking for an uneven gaze. I'm going to hold the pen 2 feet from your eyes and shine equally into both eyes. I'm going to be looking for a little pinpoint of light in both eyes at the same place. So I'm about 2 feet. Okay, look into the light. Perfect. Okay. Okay, now we're going to be checking for direct consensual pupillary light reflex. We're going to focus on something across the room. We're going to turn off the light. I'm going to shine the light in your eye and see if your pupil constricts when I shine the light on it. And then we're going to cover the other eye and see if the pupil that's covered still restricts.
Okay.
Sound good?
Mm-hmm.
Okay, turn off the light. Okay. You focused across the room?
Mm-hmm.
Okay, and now I'm going to move it. So go ahead and cover your eye. And then I'm going to shine the light again. And that restricted. Now move the cover. Okay, so they were both restricted, constricted. Now I'm going to do the other side.
Okay.
So, okay, go ahead, cover. And I'm going to shine the light and your pupil constricted. And then go ahead and move the cover. And then it constricted after. Okay, perfect. Go ahead and turn on the light. Okay, so now we're going to test eye accommodation. I'm going to have the pen light. I'm going to hold it about 15 inches from you, and then I'm going to bring it in closer to you. You try to stay focused on the pen light. Okay? We're about 15 inches. Tell me when you see it converge. Is it blurry? Okay, perfect. The next thing we're going to do is the cover and uncover test. So what I'm going to have you do is stare straight ahead, focus on an object, cover one eye with the card. Okay. Okay, so now just focus straight ahead on your one object. Okay. And now go ahead and cover the other eye, and again, just focus on the same thing. I'm looking for movement in your eye. Are you focused across the room?
Mm-hmm.
Okay, perfect. Okay, now we're going to have Brittany complete the eye chart. I have marked a spot 20 feet away from the eye chart, so I'm going to have her stand there. Brittany, I'm going to have you cover one eye and just start with the largest letter and keep reading all the way down until you don't think you can read anymore.
Okay.
Go ahead.
E, F, P, T, O, Z, L, P, E, D, P, E, C, F, D, Z, D, T, Z, Z, P.
Okay, good. And now go ahead with the other eye.
E, F, P, T, O, Z, L, P, E, D, P, E, C, F, D, Z, D, F, C, Z, P.
Okay, very good. Thank you. So now we're going to do the peripheral vision exam. We're going to cover opposite eyes and we're going to look at each other. I'm going to bring in my pen from different directions and you just let me know when you can see it.
Okay.
So go ahead and cover your left eye. I'm going to cover my right eye and then we'll just look at each other. Okay, and now tell me when you can see the pen.
Now. Now. Now.
Okay, and we'll do it with the other eye. Ready?
Now. Now.
Okay.
Now.
Perfect. So now we're moving on to the ears. I'm going to inspect and palpate both ears. I'm looking for any discharge, any lesions or discoloration. So I'm just going to look and I'm going to gently feel and kind of move. Does anything hurt you?
No.
Okay, I'm just going to do the same thing on the other side. Okay, so now with my light, my pen light, I'm going to shine inside your ear and I'm going to be observing your tympanic membrane. If you just want to look that way. So I'm looking to see that A, it's intact. Look over this way. That it's rather pearly, gray, shiny. A little bit of earwax is normal and there's not too much, just a normal amount, which is healthy for your ear. Okay, so the next thing we're going to do for Brittany's hearing is to do the whisper test. I'm going to have Brittany stand so I can be about 2 feet behind her. Go ahead and cover your left ear. I'm going to whisper something and you go ahead and tell me what I said.
Okay. Football.
Perfect. And now we're going to do the same thing with the other ear. Cover your right ear. Okay, I'm going to say something.
Popcorn.
Perfect. Okay, Brittany, now I'm going to be inspecting your nose. I'm first going to look at it. I'm looking for symmetry, make sure it looks centered, no obvious lesions. Secondly, I'm going to have you cover one nostril, breathe in through the other side, and then repeat with the other nostril.
Okay.
Go ahead. Okay. Feel okay?
Yeah.
Okay. Now I'm going to look inside. I'm going to be checking your mucosa. It should be dark pink and moist. Nothing abnormal. Looks good. Okay. Good. Perfect. Lastly, I'm going to be checking your olfactory nerve. So I'm going to have you cover one nostril and then have you breathe in and tell me if you can smell what this is.
Cinnamon.
Perfect. Okay, now do the same thing with the other side. Cinnamon. Perfect. Okay, now we're going to be assessing her mouth and pharynx. For this assessment, I'm going to put on a pair of clean gloves. And in this assessment, I'm going to be covering her lips, her teeth, her gums, oral mucosa, tongue, tonsils, and uvula. First, we're going to start with just observing your teeth. So I'm going to have you open your mouth. I'm going to tilt your head a little bit so I can see in back. Looking for any missing teeth, for teeth discoloration, just general health of your teeth. Secondly, I'm going to have you bite down, looking for your jaw alignment. Okay, looks good. Now I am going to just pull your lip down gently. I'm looking at your gums and at your mucosa. I'm going to do the same with the top. Okay. I'm gonna do this. I'm gonna open up your cheek a little bit and with my pen light, just gonna be looking at your inside your cheeks. Okay, the same on this side. Okay, put this lip here. So now I'm gonna have you go ahead and stick out your tongue. Move it from side to side. Maybe looking at your tongue strength. And I'm gonna have you just stick it straight out also. Okay, perfect. Now I am going to have you actually go ahead and put your tongue to the roof of your mouth. And I'm just looking on the ventral portion of your tongue. Looks good. Okay. Now I am going to grab your tongue and gently just kind of move it from side to side. And so go ahead and stick it out. Just gonna grab it and gently go. Just looking for any lesions. Does that hurt at all? Okay. This. And now I'm going to put my finger against your cheek. I'm going to have you just push as hard as you can with your tongue and push my finger away there. Or push on my finger. Okay. Do the same thing on the other side. Perfect. Okay. Okay, for the next part of her mouth assessment, I am going to put on a pair of clean gloves. Going to be inspecting the roof of her mouth with my pen light. Go ahead and open your mouth, please. Okay, and I'm going to get my tongue depressor. I need you to stick your tongue out. Say ah. Ah. Okay, and while I'm back here, I'm looking at your tonsils. So now I'm going to palpate Brittany's cervical lymph nodes. Make sure they're not swollen and then make sure they're symmetrical. Does that cause you any pain?
No.
Okay, and now I'm going to feel for her carotid pulse. Okay. Okay. We're moving on to the respiratory assessment for Brittany, starting with just observing her back, looking at the position of her scapula, making sure everything looks symmetrical. Kind of want to see how my hands, if they move equally when she takes some deep breaths. Go ahead. Deep breath. Out. Perfect. Okay, so the next thing we're going to do is percuss her respiratory excursion. So I'm going to start by gently percussing all the way down her rib until I note a change in tone. For this, I need you to exhale forcefully when I tell you to. If you're uncomfortable at any time, you just let me know and we can stop. Okay? So you're going to exhale forcefully and hold your breath. Okay? Ready? Go. Okay. So I know a change in tone right about here. Make a small, go ahead and breathe. Sorry. Okay, take a couple of deep breaths. And then from the mark, we're going to percuss a little bit more downward. Once she inhales, and we'll note a change in tone again. So go ahead and inhale and hold your breath. Okay. Okay, go ahead and breathe. It's like right here. So we're just going to measure. Normal is anywhere from 3 to 5 centimeters in difference. And she's right at 3. Okay, we're going to do the same thing on the other side. Are you comfortable?
Yep.
Okay, so go ahead and forcefully exhale. Okay. Okay, go ahead and breathe. Okay, I'm going to go from where the marking is and start again. So, do you have some good breaths?
Yep.
Okay, so now inhale and hold your breath. Okay, take right there. Go ahead and breathe. Right there. Make a little mark. And go ahead and measure that. Okay. This one happens to be right around 3.5 on this side. Like I said, normal was 3 to 5 centimeters. Now I am going to palpate for any fremitus. I'm going to, with the ball of my hand, do kind of a zigzag formation across your back, and every time I place my palm, you just say the letter or the numbers 99.
Okay.
Go ahead.
99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
Okay. Perfect. Now I'm just going to auscultate Brittany's breath sounds posteriorly. Just do some normal breathing. Just do some deep ins and outs. Go ahead. 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 And go ahead. And go ahead. Okay. Now we're going to do the anterior portion of Brittany's respiratory assessment. In an effort just to be modest with this, I'm going to do more verbalize my assessment as I'm doing it, and then just have it filmed from behind. I'm having Brittany sit so I can kind of visualize the position of her sternum. If I were to take her top down, I could look at her intercostal spaces, observe if she has any use of accessory muscles when she breathes. What I can note from here is that she's not having any work of breathing. She's got good color. Her sternum looks like it's midline, looks the way it should be looking. I'm also going to kind of just feel. I'm going to start at her clavicles, and I'm going to start moving downward. I'm going to palpate, and I'm feeling for temperature. I'm feeling for any tenderness. If there's any does any of that hurt? Feeling for any fremitus. Okay, now I am going to I'm going to auscultate her breath sounds. I'm going to start just above her clavicles. I'm going to kind of move in a zigzag formation, and I'm going to have her take breaths from her mouth to avoid any extra noises from her nose. Go ahead and breathe, do mouth breathing. Go ahead. Go ahead. Okay. Now I'm going to be listening to Brittany's heart sounds. So we're going to be filming this from behind so that we have a little bit of modesty going on here. I'll verbalize again what I'm doing. I'm going to have Brittany kind of lean forward and exhale. I'll tell you when to do that. I will be using the diaphragm of my stethoscope. I'm going to place it over her, the apex of her heart, kind of left sternal border, and then I will auscultate from there. All right, so go ahead and lean forward and exhale. Okay, so she had normal heart sounds. At this point, we're going to do Brittany's musculoskeletal assessment of her upper extremities. We're going to be looking at her range of motion, which will be observing her flexion, extension, abduction, adduction, and looking at her motion against resistance. Okay, so now we're going to have Brittany stand with both arms at her sides, and we're going to bring both arms forward, okay, all the way above her head, okay, and then we're going to keep your elbows straight, and then we're going to go all the way as far back as you can behind your back, okay, and then you bring your arms back down. Now bring both hands together overhead with elbows straight, and then lower your hands, go down the middle. In front of your body, just below your midpoint with your elbows still straight. Now bring both arms behind your head. Interlock your fingers behind your head. And now you're going to move your hands to behind your lower back with your elbows flexed. Is that comfortable? Okay, so bring your arms in front of you now and just bend your elbows as far up as you can. Okay. Now just put your arms out for me and rotate both your wrists in all the way out. Okay, now put both your hands in a fist, open and close, and then just one at a time. Do your thumb and your index and your middle, ring and pinky. Perfect. Okay, now I'm going to have you squeeze my fingers so I can feel some strength. Squeeze as hard as you can. Okay, now try to push my arms up as I hold them in place. Okay, now you put your arms together, and you push down as I push up. Okay, now push up against me. Okay, and the last thing I'm going to do is look at her spinal accessory muscle by pushing down on her shoulder, and then she is going to push up against my resistance. 1, 2, 3, go. Okay. So at that point, I was looking for symmetry and strong contraction of her trapezius muscle, which everything felt symmetrical. Due to timing constraints, I needed to do my head-to-toe assessment in 2 parts. So today I'm going to do the second part of my assessment. I will start again with washing my hands. So same as yesterday, if at any time you're uncomfortable with anything, you just go ahead and let me know, and we can alter or stop whatever you're uncomfortable with. And for today, I'm going to start with her cardiovascular and lymph assessment. So I have Brittany laying down. I'm going to start first by just visually inspecting her carotid arteries. So go ahead and turn your head to your left, please. I'm going to look. I'm going to use my pen light to improve visualization, and I can see it there. Okay. Secondly, I'm going to auscultate her carotid pulses with the bell of my stethoscope. While I do this, I'm going to have Brittany hold her breath. Okay, go ahead. Breath, please. Okay, let me see the other side. Okay, go ahead and breathe. Now I'm going to palpate both sides. I'm going to start with one side. Okay, turn your head towards me. So at this point, I would be inspecting her precordium. Again, in an effort to be modest, I'm going to kind of verbalize more what I would do, since it's kind of hard to do it without exposing too much. But I would be stand on the right side of her. I have Brittany elevated as best as I can between 30 and 45 degrees. I would be looking at her apical pulse, which would be right here, and then noting any abnormalities And then I want to palpate her precordium and locate her PMI. I would again stay on her right side and use 1 or 2 finger pads to palpate her apical pulse. Her PMI would be located 4th or 5th intercostal space mid-clavicular line, which should be kind of right around here. So I can feel that now. Okay, and no irregular heartbeat noted while I was palpating that. So the next part of my assessment would be auscultating Brittany's heart sounds. Again, trying to respect her privacy. I do have her covered. I think it'd be easier at this point to kind of just verbalize the specific points where I will be auscultating the different heart sounds on our assessment. The first one would be her aortic heart sound, which is at her 2nd intercostal space. The next thing would be her pulmonic, which is 2nd and 3rd intercostal space close to her sternum. The third location would be her Erb's point, which is 3rd to 5th intercostal space at her left sternal border. Next would be tricuspid area, which is 4th to 5th intercostal space at the lower left sternum. And the final will be her mitral area, which is located at her 5th intercostal space near the left mid-clavicular line. I will be listening, but I won't have it zoom in too much, just so we can keep it modest. Again, this assessment's a little bit difficult to do while having Brittany's top on. I'm trying to move the sports bra a little bit and listen, and to the best of my ability, could hear no irregular or abnormal heart sounds. So at this part, we're going to assess Brittany's abdomen. I've started with having Brittany just lay comfortably with a pillow underneath her head. I'm going to have her breathing through her mouth, taking nice, slow, deep breaths. Making sure she's nice and comfortable. If at any time when I'm touching something in her abdomen, if it's tender or painful, just let me know. I'm going to start by just kind of getting eye level with her stomach and looking for symmetry when she breathes. Making sure there's any obvious abnormalities. So go ahead and just breathe through your mouth and just take nice, easy breaths. I'm going to lift your hand a little bit so you can kind of put it across your chest. Just kind of get level with your stomach and just go ahead and take some deep breaths. Okay, so her breathing looks, her abdomen looks symmetrical and no obvious abnormalities while she's breathing. The next thing I'm going to do is auscultate all 4 quadrants. And also listen to her aorta for bruits with the bell of my stethoscope. So I could hear normal bowel sounds every few seconds in all 4 quads. No bruits were heard when I was auscultating her. aorta. Now I'm going to percuss all 4 quads gently. And I'm going to do that by just putting my hands across each quad, and then I'm going to tap. And I will also do this over her liver and her spleen in her upper right quadrant. So we'll start in her left up here. Be feeling for any abnormalities, listening. Does any of that hurt? Okay, let me know if it hurts. So I'm feeling for her liver and her spleen, trying to percuss over that. Her liver, kind of go over a little bit. So now I'm going to gently palpate all 4 quads, looking for any kind of masses, and then I'm going to do a more palpate deeply all 4 quads after I do the light palpation. If anything hurts, you need to just let me know, and just go ahead and just breathe slowly. Go ahead and breathe through your mouth as I palpate all 4 quads. I'll start with the upper left. I'm doing it gently, feeling for any masses. Now I'm going to do a deeper palpation of all 4 quads with both hands really pushing in and feeling for any masses or abnormalities. Are you comfortable? Yep. I'm taking deep breaths. Yep. Okay. I don't feel anything abnormal. Next, I'm going to palpate her liver. So I am going to place my left hand behind her, right about the 12th rib. So I'm going to put my hand underneath there, and then I'm going to put my right hand kind of parallel to my left hand, and I'm going to have her inhale, and while she's inhaling, I'm going to compress down and support her. I'm going to palpate upward and inward and support her a little bit with my left hand. So are you ready? Yeah. Okay, so go ahead and breathe in. Again, feeling for any masses on the spleen, or on the liver, I'm sorry. Okay, and now I'm going to do I'm going to be feeling for her spleen. So when I palpate the spleen, I'm going to reach around with my left hand and kind of support her. And then I'm going to put my right hand up front above her spleen. And I'm going to have her, I'm going to put my right hand kind of over the lateral space in front. Again, I'm doing the 12th rib. I am going to have her inhale. And while she's doing that, I'm going to press inward and upward and palpate her, her spleen. Okay, so we're trying to feel her 12th rib. I'm going to support you a little bit. So now inhale, and inward, upward with my finger, feeling for any masses. Okay, go ahead and breathe. Okay. Now I'm going to be assessing Brittany's pulses from top to bottom. We already did her temporal with the head assessment, but I'm just going to go ahead and do it again. Okay. Again, if anything's uncomfortable, you tell me. So I'm going to assess it on both sides. So those are her temporal arteries. Now I'm going to assess radial on both sides. Okay. And now I'm going to do brachial just above the bend of her knee, or elbow. Okay, the next artery would be the femoral. Again, we're just going to talk through this one. So if I was going to be palpating her femoral artery, it would be just below her inguinal ligament. So right there, kind of her upper thigh. So we'll just kind of verbalize that one. Then go ahead and, actually no, I'm gonna do popliteal artery, which is behind her knees. I'm gonna feel those. Okay, feel on this side. Okay, and now I'm gonna do the dorsalis pedis artery, which is on the top of her foot, so go ahead and just stand. Okay, perfect. Now I'm going to do the Allen test to both wrists. So what I'm going to do is I'm going to start with her right side. I am going to occlude both the ulnar and the radial artery. Have her make a fist. I'm going to occlude both arteries. Okay. And then when I tell her to, she is going to open her fist, and while I'm still occluding both arteries, and then I'm going to release the ulnar one and see if color returns to the palm of her hand. So go ahead and open, and then I'm going to let go, and then the palm of her hand turns pink again, and I can still feel it pulsing on the radial side. Okay, I'm going to do the same thing on this side. Yeah, perfect. So I've occluded both arteries, and then go ahead and open. And then I'm going to let go. And the color returns to the palm of her hand. Perfect. Okay. Next thing I'm going to do is just kind of be looking upper extremities, look at her skin color. I'm going to be looking her nail bed. She has artificial nails, but there's some nails you can gone, so I can check her capillary refill, which is less than 3 seconds. It was immediate. Looks good, good. Skin tone throughout. I'm going to do the same thing on her lower extremities. I'm going to look for even skin color, hair distribution, varicose veins. I'm also going to do the cap refill on her toes, which they're polished, but some of the polish is gone, so I can observe. Okay, don't see any obvious discolorations, so turn around, observing for varicose veins or anything abnormal. Now we're going to be doing range of motion with Brittany's lower extremities. So we're going to do one leg at a time. We're going to start with her left leg. Brittany, please raise it as far as you can comfortably. Now you're going to bend at the knee and bring your knee in towards your chest as far as you comfortably can. Okay, now bring your knee, straighten it out. Swing your leg out as far as you comfortably can. Okay, now bring your knee back in, bend it at the knee, and fold it towards your other leg. Okay, does that feel okay?
Mm-hmm.
Okay, now we're going to do it the same thing on this leg. So go ahead and just with your knee straight, bring it up as far as you can towards you. Okay, now bend your knee and bring your knee in as far as you can towards your chest. Now straighten your leg back out and swing it as far out as you can. Okay, and now bring your leg back in, fold your knee, and fold it over onto your other side as far as you can. Okay. For the last part of our range of motion to Brittany's hips, I'm going to have her bring her legs up from behind. So Brittany, keeping your knee straight as comfortably as you can, go ahead and lift this leg. Okay, and then go ahead and do the same thing with the other leg. Perfect. Okay, so now go ahead and get off the bed and stand up, and now we're going to do range of motion to her knees. We'll do one at a time, so we can start with your right side. I just need you to bend your knee and take it as far back towards your buttocks as you can. Okay, bring it back down. And then again with the left, just lift your leg and bring it up as far as you can towards your buttocks, and then back down. Okay, and then I need you to sit on the edge of the bed. And now I'm going to do range of motion to your ankles one at a time. So I'm going to have you with your right foot, bring your foot up as far as you can, and now bring it back down and rotate it outward, rotate it inward. Do the same thing with your left, go up as far as you can, go down, go out, and then keeping your knee straight, and then go inward. Okay. Then the last thing I need is for you to curl your toes on your right foot as far as you can. Release, and kind of spread your toes. There you go. And then do the same thing on your left. Curl, release, try to spread apart. Perfect. During this part, we're going to assess, or we're going to complete the neurological assessment on Brittany. We're going to do memory, mathematics, general knowledge, abstract thinking, and judgment. For memory, we're going to do immediate, recent, and remote. For immediate, I'm going to give you a set of 6 numbers, and I need you to repeat them back to me in the same order I give them to you, Brittany.
Okay.
930251.
930251.
Perfect. Can you tell me what you had for dinner last night?
Pepper steak.
Okay. Can you tell me what school you attended for 2nd grade?
Zerger Elementary.
Okay. We'll do mathematics now. Can you tell me what 9 times 7 is?
63.
Okay. Can you tell me who our current president is?
Obama.
Okay. For abstract thinking, I'm going to ask you to compare and contrast a little bit.
Okay.
So if you could tell me what would be a similarity with a lime and a lemon?
They both start with L's.
Okay. What would be a difference?
Their color.
Okay, perfect. And then for judgment, tell me, what would you do if your house was on fire?
Evacuate.
Okay, anything else?
And call 911.
Perfect. Okay. Next thing we're going to do is we're going to test for rapid coordination. So I'm going to have you with your hands. I'm going to have you alternate movements. We can just do one hand at a time and just touch every finger to your thumb and just go back if you can. And go ahead and just do that quickly. Perfect. And then we'll just do the other hand. Perfect. Okay. Brittany, now I am going to be assessing for superficial and deep sensation. I'm going to be touching your arms, your hands, your feet, and your legs. And you just tell me either if you can't feel it or if I'm hurting you. So I'm going to start with some soft strokes and just let me know if you can feel it.
Yes.
Okay. Can you feel that?
Mm-hmm.
Okay. So now I'm going to go a little bit stronger. Feel that? Okay. Can you feel that? Okay, I'm going to try on your other arm. Can you feel that?
Yep.
Okay, I'm going to go light on your hand.
Yep.
Okay, and I'm going to go a little bit stronger.
Yep.
Feel that? Feel that?
Mm-hmm.
Okay, now I'm going to do the same thing to both your legs and your feet. So I'm going to start with light touches. Can you feel that?
Yep.
Okay, and then I'm going to do deep touches.
Mm-hmm.
Feel it? I'm going to do light to your foot.
Yep.
Okay, and then deep.
Yep.
Okay, I'm going to do light to your left leg.
Mm-hmm.
And then deep.
Yep.
Light. And then deep.
Yep.
Okay. Brittany, the next thing I'm going to do is I am going to write a number on your hand, on the palm of both hands. I'm going to do one at a time
Okay.
with your eyes closed. And then you go ahead and tell me without looking what number I wrote on your hand.
Okay.
So go ahead and close your eyes. Okay. Take this hand. What number?
5.
Perfect. And I'll do it on this hand.
3.
Okay, perfect. Now I'm going to have you close your eyes one more time.
Okay.
I'm going to place something in your hand, and you need to tell me what it is that I've placed in your hand.
Okay.
So go ahead and close your eyes. Okay, so I'm going to put it in your right hand. I'm going to close your hands. And you tell me what you feel.
Almond.
Perfect. Okay, now we're going to continue with doing Brittany's upper body reflexes. I'm going to start with her bicep, and then we're going to go down to her brachial radialis, and then we're going to do her tricep. So I'm going to have you just rest your arm. I'm actually going to get on this side for the bicep reflex. And I'm going to put my thumb just above the elbow. I'm going to strike my thumb. Ready? Relaxed? Okay. Okay, so I could see a little bit of a contraction there. Then I'm going to come around. Rest. You comfortable? Okay, strike right under your wrist. Perfect. And now I am going to, again, kind of just let your arm hang. come from behind here. Let your arm just kind of hang. And I'm going to strike from, actually I'm going to hold your arm right here. I'm going to strike your arm from behind and look for this to kind of contract. Okay, so you can see it right there. I'm going to do it one more time. Perfect. Okay, so now I'm going to come over and do it to this side. So again, just let your arm relax. Put your weight on my arm. I'm going to strike my thumb. Perfect. And I'm going to come from behind. Actually, I'll switch hands and go right under your wrist. Oh, sorry, I didn't feel it that time. You comfortable? You resting? Okay, perfect. Now we're going to just rest your arm from below here. I'm going to just let it hang. We'll go from behind. Are you resting? Okay. Okay, you can see that contract easily. So for the final part of the assessment, I am going to be doing Brittany's, assessing her spine. I'm going to be assessing her gait. We're going to do a deep knee bend and do the Romberg test. So I'm going to lift her shirt from behind. No, don't bend over yet, Brittany. Just stay straight. I'm going to be looking for just normal straight alignment of her spine. Just kind of feeling as it goes down. And then I'll have Brittany bend over a little bit. Okay, and just looking for normal, you can rest your head for a little bit. Looking for normal curvature of the spine as she bends over. Okay. Now Brittany, I'm going to have you stand up, take a few steps back, and then I'm going to have you do a heel-to-toe walk. I'll have you take about 6 steps. 1, 2, 3, 4, 5, 6. Perfect. Okay, come back, and we're going to walk on our tippy toes. Just take a few. Well, you know, I'm going to have you do it again, but just lift your pants up because I can't see. Thank you. Okay, go ahead and do it again. There you go. Perfect. And then come back. And now we're going to walk on the heels of our foot. Just take a few steps. Make sure you're comfortable. Is that comfortable? Okay. Now I'm going to have you do a deep knee bend. So just go down as far as you comfortably can. Okay. Back up. Is that uncomfortable? Okay, now we're going to do the Romberg test. So I got my timer here. For 20 seconds, I'm going to have you put your arms to your side, put your feet together. You're going to close your eyes, and I just need you to try to stay as still as you can. If you ever feel like you're going to fall or like you're uncomfortable, just open your eyes and we'll stop. Okay. Okay, tell me when you're ready.
Ready.
And go. Okay, you're almost done, Britt. Okay, perfect. This concludes my head to toe assessment. Thank you for watching.